Welcome everyone. We're going to go ahead and get started. This is the New Media Best Practices Using Data Visualization and Infographics webinar, and I want to welcome all our returning audience and new members as well. My name is Lisa Peterson, and I'm a New Media Education Specialist with the California Pacific Public Health Training Center here at UC Berkeley School of Public Health, and we're very happy to sponsor this webinar with the Center for Health Leadership. And this is our fourth session in our latest New Media Training Series, whose theme is all about honing in and finding out if what we're doing is having the impact we intend, learning how best to measure what we do, build upon what's working, stop doing what isn't, and then really to learn from guest organizations some best practices for how to build a social media presence that matters. And today we're going to delve into and explore how to translate complex data into something both visually appealing and meaningful. So that will help us do just that. I'm going to be your moderator today, and to help facilitate the discussion, before we dive in, a couple of reminders. Please be sure to mute your phones by pressing *6, and also know that we'll be recording both the webinar's audio and chat features. So if you don't want to be recorded, please refrain from using the chat feature. Also, please be sure to let us know in the chat box if you can hear us okay, and if we need to speak up, let us know and we'll do our best. So today, you're going to be hearing from a really amazing lineup of speakers, including Sheila Baxter and Leslie Safier from Healthy Communities Institute and Leslie Yang from Awasu Design. I'll also be here to help facilitate the conversation. A little bit about where we're going to go today. We'll take some time to learn and hear about best practices in the use of data visualization and infographics from our guest organizational speakers, as well as get some important key takeaways. And after each speaker's presentation, we'll have some time for questions and comments. And at the very end, as we close out, we're going to take a moment to reflect on what kind of action step, one small step you think you might be able to take as you move forward to hopefully put into practice some of the wonderful and rich things that you're going to learn today. So our objectives for today are to give a sense of how you can use these tools to further your organization's goals through the examples and strategies that our presenters are going to share, and that you're going to learn some valuable tips for either getting started or moving to the next level if you're already using data visualization and infographics in your work. And a little bit of housekeeping. I do see from Gail wondering if about the audio portion of the webinar. You do need to dial in for the audio portion, which will come through your telephone and not through the computer speakers. So I will be sending that access code again in just a moment. In the meantime, just a bit about housekeeping. Please be sure to have your phone on mute. We welcome you and encourage you to use the chat box to insert any questions or comments that you have, and I will be moderating that as we go along so that we can hopefully address them during our Q&A sessions following each presentation. And we do invite you to get involved in the dialogue around this topic and to tweet the event. We have a hashtag CalPactNM14, so we invite you to get into the conversation about what you're learning here. Great. So I'm very honored to introduce our first guest speakers for today, Sheila Baxter and Leslie Safier from Healthy Communities Institute. I'm going to let you know a little bit about each of them before we get started. Sheila Baxter is the Director of Business Development and is responsible for the development and growth of partner relationships nationwide and for expanding and refining HCI's vision and strategy. Sheila also serves on the Board of Directors for the UC Berkeley School of Public Health's Alumni Association. And prior to joining HCI, she worked for the Ministry of Health and World Health Organization in Western Samoa, where she carried out national policies and projects aimed at improving community health. Sheila completed her Master's in Public Health and Health Policy and Management from the University of California at Berkeley in 2010, where she received the Heinrich L. Bloom Award for Distinguished Social Action. Leslie Safier is the Director of Research at HCI, and she has extensive experience working to make community health and well-being information accessible and understandable to people across the country. She develops and curates content for hospitals and health departments and translates this information into meaningful analytic tools and displays. Prior to joining HCI, Leslie worked with the California Department of Public Health Sexually Transmitted Diseases and Control Branch and as a researcher in the environmental consulting field. Leslie holds a Bachelor of Arts from Colgate University as well as a Master's in Public Health from Cal. Go Bears! So I think before we get started, what we wanted to do is check in with you and do a poll and get a sense with you what some of your biggest challenges are in using data visualization. So I invite you to go ahead and let us know. Is it a matter of getting started? Is it a matter of finding that story in the numbers? Great. So I'm just sending some information to everybody about the audio. And also, Amanda was wondering about our hashtag for the tweeting. That's hashtag CalPact, CALPACT, NM in caps 14. And we will definitely be sharing that in the chat box. So it looks like what we've got here is quite a few of you are looking to have the right tools and resources. And I'm excited because our speakers are really going to be able to convey some of their tips and strategies and the tools that they use. And we're going to be hearing from them shortly. I'm just getting them unmuted here. So I'm going to welcome Sheila and Leslie. Are you there?
Hi, I'm here. This is Sheila.
Great.
And this is
Take
Leslie.
it away.
All right, this is Leslie Safier, and I'll be starting us off today. I fed in several different definitions of the term data visualization into the tool Wordle, and this is the resulting word cloud. There is no standard definition of data visualization, but this image allows you to see key terms present in multiple definitions. Data visualization is a visual display of information that creates a clear and meaningful distillation. Good data visualizations help us think and display patterns and trends. This is a map or a visualization developed by John Snow in 1854. Snow mapped cases of cholera in London to help determine the source of a cholera epidemic. This map displays dark dots around the Broad Street pump. The pattern became clear. By visualizing the cases, he was able to focus his investigation and determine the source of the cholera outbreak. We have new tools to explore data, but the concept of data visualization is not new. All good data visualizations begin with a story. When you wish to develop a visualization, you should ask yourself what story you are trying to tell and what questions your visualization will allow users to explore or answer. Your next step is to identify the necessary data to support your story. Consider the best way to summarize this information, keeping in mind your primary audience's data literacy or familiarity with data. Think about what data is key to telling your story and how this data can be emphasized by font, color, icons, and positioning. Sketch out ideas for your visualization and get feedback. Iterate based on this feedback and continue to keep the goals of your visualization and your story in mind. It is critical to maintain the integrity of your data in your visualization using scales, legends, and display. This last point is demonstrated on my next slide. The image on the left shows a bar graph of Obamacare enrollment. Fox News was telling the story of how health insurance enrollment has not yet met goals, but they skewed the scale of this bar chart. 7 million is nearly 2 times the height of 6 million. Given the scale of the bar chart, you would assume the March 31st enrollment value would be closer to 15 million. Fox News did receive backlash from this graph and provided a corrected bar graph the following day with an appropriate scale. The infographic on the right shows enrollment at Purdue University. The head on the top represents roughly 1,200 people. The head below it is nearly 1,500 people, while the head on the bottom represents roughly 24,000 people. In addition to the irregular scaling, different font is used, and the racial coloring of the heads can be seen as somewhat controversial. At this point, I'm going to turn the presentation over to Sheila, who will provide background information on the Healthy Communities Institute and the HCI platform.
Thank you, Leslie. Hi, everyone. As Leslie mentioned, I'll plan to provide you with additional context as to who we are, where we cover, and the 4 main pillars of the HCI platform before jumping into a success story of a nearby client site in San Francisco. To begin, Healthy Communities Institute, also known as HCI, is located in Berkeley, about 2 blocks away from the School of Public Health. We started around 10 years ago when a group of UC Berkeley students and a representative from Harvard were lamenting the fact that there is quite a bit of quality of life and health-related data that is publicly available, but most of the data lives in organizational silos and not readily available, accessible, or understandable. HCI created a mission to improve the health, vitality, and environmental sustainabilities of communities, counties, and states by taking this already publicly available data, putting it in one place, giving it a face via data visualization tools to help support communities in achieving the collective impact model and taking informed action. Our partners tend to include local health departments, non-for-profit hospitals, foundations, coalitions, United Ways, and many others coming together to sponsor the site. Many of these groups, like the non-for-profit hospitals, can use the tools within this platform to support them in creating their community health needs assessment plans and meeting IRS 990 requirements. The local health departments leverage the site for public health accreditation purposes, community and state health improvement plans, and strategic planning. The platform can either be embedded, so branded to the organization's own web skin, or standalone, where it's neutral-facing and has a customized look and feel for numerous partnerships. So we have various national relationships, including partnerships with the VHA, a group purchasing order, and CHA, the Catholic Healthcare Association. We are currently in 35 states, covering over 100 million lives. And in 2012, Assistant Secretary of Health and Human Services, Howard Koh, presented us with the award from HHS for the Best Community Health App. A year before that, in 2011, HHS also presented us with an award for My Healthy People, where we were recognized for taking national targets, the Healthy People 2020 standards, and comparing them to how partnered counties were doing against these standards. I'm going to move forward here. The HCI platform has 4 main pillars: a dashboard of about 100 or so color-coded indicators specific to your community, which are constantly updated so that you're working with a live dashboard. Next, we offer a database of promising practices, which include over 2,000 programs and policies that have been tried around the nation shown to improve health and quality of life. Third is our initiative centers, which allows for sponsors to form working groups, set local goals, and manage achievement of objectives. Finally, we have various ways to track and evaluate data, which includes the Healthy People 2020 report card, a local priority tracker, which is a way for communities to set their own goals, and various comparative and longitudinal evaluation, including time series breakout, and if the data provides for it, health disparities breakouts, for example, age, gender, and race. So once we go online, we will show you how these pieces come together. So I'm going to move into a success story with San Francisco and nearby community, which they're focused on the citywide cost savings and reduction of ED overcrowding due to alcohol abuse. This is a representation of one of our sites in San Francisco, which is focusing on an indicator page, age-adjusted ER rate due to alcohol abuse. You'll see the gauge here, which is also an emblem of HCI, which is focusing on how San Francisco County is comparing against other California counties. They were in the green. That would have meant that
it sounds like, hold on just a moment here. Leslie and Sheila. Sheila, you dropped out on the prior slide. Can you hear me, Sheila?
No, this is Leslie, though. I can jump in.
Okay.
Yeah, and then Sheila, well, she probably can't hear me now, but whenever she jumps in, she can talk. So looking at the age-adjusted ER rate due to alcohol abuse, this is going to go into kind of the details of this page later, but I'll give you the overview. The gauge is in the red, meaning that San Francisco is the bottom quartile. They're having a lot of admissions due to alcohol abuse into their emergency room. Looking at the time series, this shows how the problem was growing over time. They were able to visualize that from 2005 to 2007 and 2009 to 2011, the problem kept growing. The rate due to admissions due to alcohol abuse kept increasing. Using this information, they just then, sorry, I have to advance the slide. They mapped San Francisco ED rates using the Healthy Communities platform tool that I'll go into a little bit later. And they could see that for the entire city, they were in red. But then when they looked at the neighborhood level, specific neighborhoods around the Tenderloin and south of Market actually did have higher rates of alcohol abuse.
Hi, Leslie. I'm back, just to let you know.
Okay. You want to jump back in?
Sorry about that. Yeah, I'll go ahead and jump back, and I apologize for the glitch there. So wonderful. So what we have here is a view of how San Francisco looks at a county view. This is all in the red here on the left-hand side. And as we overlay some of our tools that can go to zip code level, you'll see there are pockets of communities that are actually in the red. So as we look a little bit closer, you'll see the south of Market actually has a big pocket of red. And what was then decided as we move forward here, there was a citywide solution where 50 San Francisco stakeholders came together and created a sober and respite center. This was a van service which provided transportation from police and ambulance crew handoff. And from that, about 10 to 14 inebriates were diverted from the emergency department every day. The financial benefits, it operates 24/7, and the daily operating cost is less than $2,700 a day. The annual operating cost is about $1 million a year, and the approximate value of cost avoidance was about $9 million. So what we're going to do right now is actually show you the success by going into San Francisco site. Leslie will take it. Just to let you know, this particular solution really helped reduce the citywide cost for chronic public inebriates and helped tell a story. The data told a story, and a multi-sector collaborative came together for a citywide solution. So with that, Leslie, I'll hand it over to you. She'll look over San Francisco and Alameda site, and I'll actually be able to show you a couple of additional sites outside of California in Pennsylvania and Nebraska.
Okay, I should currently be sharing my desktop. This is our Health Matters in San Francisco site. I'm going to focus this portion of our presentation on HCI's data visualization tools. Our goal is to provide users an easy, intuitive method for identifying top community needs. Central to this goal is our iconography. We have chosen a gauge icon, an arrow, and a bar chart to show how a regional value compares to other counties, a previous value, and a target value respectively. This is an example of a community dashboard that shows all available indicators on the HCI platform for San Francisco. This is a central launch pad for our users to explore the variety of indicators we offer. In the right-hand column, an image is displayed to give users a snapshot of their region's health. This dashboard can be sorted by status, green, yellow, red, to get a quick overview of health needs. The gauge is color-coded with the universal scheme of red, yellow, green to be easily identified and understood by all users, including the general public. The comparison the gauge reflects is listed to the left of the gauge. This was added to put the comparison in context and maintain the integrity of the data. To find out more information about an indicator, you can select the indicator's name. I'm going to open up the age-adjusted hospitalization rate due to diabetes indicator. This opens up the indicator details page. We are actually undergoing a stylistic update of this page to be released later this summer, and I'll explain the key features and functionality of this view and provide an introduction to the updated indicator detail page. The gauge sits on the left side of the page and shows the 50th and 75th percentile of the data distribution. When the dial is pointing to the green, the community's value is in the top 50% of the distribution, as is for the age-adjusted hospitalization rate due to diabetes. When the dial is pointing to the yellow, the community's value is between the 50th and the 75th percentile. When it's pointing to the red, the community is in the lowest quartile for that indicator. Key data details are shown to the right, including the value, the time period, the location, and the comparison. You can click into the map to visualize the indicator gauge. Sheila showed a screenshot of this earlier. And view demographic information as well. So this is showing San Francisco at the county level. It's in the green. It's 11.3 hospitalizations per 10,000 population, 18 plus. It's important to us to really keep the unit tied to the measurement. I'm going to switch from the county view now to the neighborhood view. And this shows how the different neighborhoods in San Francisco are faring. You can see some differences as you click in. You can see how Bayview Hunters Point has 33.1 hospitalizations, and South of Market has 22.1 hospitalizations per 10,000 population, 18 plus. You can also overlay demographic information. This allows users to explore and identify demographic characteristics that may be associated with data points. So I'm going to overlay with the percent population African American. And you can see some of these regions with high diabetes do have a higher percentage of African American inhabitants, but as well as some with lower hospitalization rates due to diabetes. Now I'm going to go back to the main indicator detail page. Below the main data display is text describing the indicator and its importance, notes about the data, source information, and historical information. Now I'm going to jump over to the updated display and explain the changes that were made. So here's a first look at our updated indicator details display. Quickly, I'm just going to pull up an image here. And this is just one example of the iterative process. You can see here the piece of paper kind of printed out the view, spoke to some different people, and just said, I love this. Can this be closer to the image? Should this be made smaller? So this is an example of kind of how, looking at this with a group, how we iterated and kind of came upon the final design. Okay. Coming back to this screen, I'm going to describe some of the changes that were made. The indicator name and description has been moved to the top of the page due to its importance. The left-hand side now shows the gauge, but the text detailing the distribution cutoffs have been removed. The comparison has been moved closer to the related data, and the data value appears larger. We wanted to draw the user's eyes to this value, and we have moved the measurement period closer to the indicator value and gauge to aid in interpretation. We replaced the text "View the legend" with a simple question mark icon. Really tried to simplify this view and just pull out the elements that are really critical to understanding. The location of the data point is also emphasized, as this is critical to understanding. Instead of separately listing a data source and a data source URL as we did previously, the source is now a link indicated by the associated icon. Notes related to the data have been moved up closer to the actual data point to aid in interpretation and maintain data integrity. The other tabs on this page show how data compares over time. The page layout is very similar, but the icons and comparisons have changed. Our users are often interested in viewing an indicator different ways compared to different comparisons, and these multiple comparisons permit this exploration. Content related to the indicator is shown in the right-hand bar to provide users easy access to explore related contents, topics, and content. All right, I'm going to jump back to the San Francisco page now. And I'm going to show you a tool that San Francisco created to track their progress towards community health improvement goals. The indicators are grouped by their priority area, such as ensure safe and healthy living environments, increase healthy eating and physical activity, and increase access to quality health care and services. And the current value and the target value are displayed, as well as a visual showing these values. So here's the current value and the target, the visual. As you mouse over, additional information comes up. That's something to consider in your visualizations, having multiple layers of information. And there's an image right on the right that easily shows the target status. So users can immediately come and see how many targets San Francisco has met and has not met. Community members can visit this page and learn about San Francisco's priority areas and their health improvement goals. Clicking into an indicator name brings up the indicator detail page we explored earlier. I want to draw your attention to the various target tabs located at the top of the indicator. Here, San Francisco has created a community target for 2016 as well as 2020, and has shown themselves in relation to the Healthy People 2020 target as well. Looking at the 2016 community target, because that's the most near term, you can see they've come up with a target of 11%. They've described in this topic below the progress that they've made in the last year getting towards reducing the rate of adults who smoke to 11%, or the percentage of adults who smoke to 11%. As you scroll down the page, the indicator mentions that this data is maintained by Building a Healthier San Francisco Coalition. The indicator looks identical to the HCI maintained indicators, but reflects locally added data. Healthy Communities Institute's clients can create their own indicators using our platform and use our presentation layer to share local data with the community. Similar to our San Francisco site, Alameda County has recently launched Healthy Alameda County. Alameda County has chosen images, let me scroll up a second, great. Images and content to be displayed on their homepage that reflects the county and their priorities. They also have the option to translate this website content into various languages, making the site accessible to their diverse community. I'm going to show you one feature here called the Report Assistant. This tool allows you to pool content together for report writing and for grant writing. So I'm going to create a report around the topic of diabetes. Indicators that relate to diabetes, as well as promising practices, news, and funding opportunities all come up in this report creator. I'm going to select a couple indicators related to diabetes that I want to show my community, as well as some promising practices, which are different evidence-based interventions, not just evidence-based, a whole different type of, all different types of interventions, but including evidence-based, effective practice, and good ideas. So different interventions that you can use to target diabetes or many other health conditions in your community and quality of life. Now I'm going to customize my report. I'm going to give it a title, a description. I can add different descriptions, but I'm not going to for the sake of time. I'm going to run the report right now. And so this provides a quick living report of the different indicators of diabetes in Alameda County. You can see their age-adjusted death rate due to diabetes next to the percentage of adults with diabetes and the percentage of adults in the Medicare population that have diabetes. On the bottom then you see some different promising practices that could potentially be employed in your community to address these rates of diabetes. This is a great tool for bringing people together, quick image to really show how a diabetes is affecting your community and some different strategies you can use to address it. At this point, Sheila is going to jump on the phone, and we're going to lead you through a few more examples.
Thanks, Leslie. All right, well, let's go ahead and move away from California and head out to Nebraska, where this collaborative, there we go. This collaborative, as you see under the sponsorship page on the left-hand toolbar, lots of different groups came together to support this site. So like San Francisco, they're working on their community health improvement plan. And what I wanted to focus in on was their Douglas County, Nebraska CHIP. So that tab there where you see they are focusing on various priority areas, access to health services, for example, violence injury, injury rates. So I'm going to go ahead and click on access to health services. This is one of their priorities. And we're looking at what they're tracking. So you'll see their goal up top, some of the various indicators that they're tracking right below that, and a brief synopsis of their various objectives. So as we scroll down, we're able to take a look at what they're trying to accomplish, and they created their own legend on where their objectives are. Have they been met? Are they in progress? Have they started it yet? So you'll see most of them are in progress. And the nice part about this particular layout of information, under progress, you could actually get more information on these types of objectives. So if we look at review summary, this gives you an in-depth view of how they're approaching this particular objective. So activities completed, what revisions have been occurring, the progress of it, and when they plan to meet, so an actual calendar. So this is one layout of information that many of our clients are excited about and trying to incorporate. If we go ahead and move over to Pennsylvania, we're going to go ahead and see a kind of different look and feel. This is branded to St. Mary Medical Center's website. You'll see that the look and feel is different than the other sites that we've highlighted. It's actually living within their own website, and they're focusing on their community health needs assessment. So as we scroll down, you'll see the report that they've completed, their implementation strategy. And I just wanted to highlight they actually created an implementation tracker. So if we go ahead and click on that, you can see similar to these other layout of information like the Healthy People 2020 local priority trackers, this one's specific to an implementation. So these are various areas that they're tracking there. So we're going to go ahead and head back to our PowerPoint presentation for a couple of summary slides. So we will move on forward here. And this is our contact information. So at HCI, we provide free online demonstrations of our platform and are happy to connect with any of you interested in setting up a demo for your organization. So feel free to email us. Also, there's a list of the links we explored today right below our information. The next is a process summary slide, which Leslie actually went over earlier on in the demonstration. So this is a good just a synopsis of what we covered today. And finally, the last two slides, and I know this is areas of interest for many of you that are joining today, are resources that we can refer to as you develop or expand your own data visualization tools. So here's a couple of books, background information, additional tools, websites, as well as some inspiration on how to get started. That being said, we'd like to thank Lisa for presenting us with the opportunity to speak today and for everyone on the line joining us. Lisa, we'll turn it back to you for the Q&A.
Great job, Leslie and Sheila. Really informative and kind of a deep dive into a wonderful platform there. And we do have some questions we're going to go to now, and I do welcome folks to, if you have any questions or comments, to go ahead and put them in the chat box now. And kind of bouncing off what you just shared, Jared had a great question about how can this practice work in a community health center organization. He's asking what kind of pitch could one make for engaging with HCI to utilize this tool for a large community health center organization that's spread, for instance, across a large state. And Jared's commenting that he thinks there's an opportunity to change the format from county to hospital systems, but he'd really like to hear more about your thoughts on creating an organization-specific tool. Is that possible?
Yeah. Absolutely. I'll take a stab at answering that. We actually have some statewide sites, Jared, around the nation that various organizations have partnered with. For example, the Hospital Association and the State Health Department in Kansas has done an excellent job. We're happy to send over a site. But in terms of organizations, many of our partnerships range. So we actually, I know today we talked about a lot of collective impact, collaborative, various groups coming together. But we do work with organizations that can actually embed the system within their site and make it their own. The tool is very customizable, so if you've collected your own data, let's say within a hospital, you can upload that within the system and be able to add in additional reports or information of interest to highlight to your community. So it's really giving yourself a face and making a name for yourself with the information you have and displaying it in a way that people can understand and relate to. Leslie, do you have anything else to add there?
No, I think you gave a great summary. Another thing we're working on kind of behind the scenes is some higher level metrics and ways to kind of look at an index of community health and really force someone who's working across the state to be able to identify different areas kind of as a snapshot.
That's great, Leslie and Sheila. Thank you. And we'll just reiterate, because I know that early on we'd gotten some questions. Amy had made a comment about wanting to hear about resources used to actually create these data visualization, and we're going to talk more about infographics. So I'm glad that we have these resources that you've shared. But as you've noted at the bottom of the slide, it's not by no means an exhaustive list. And so I welcome you all to, if there are tools or sites or platforms that you find particularly useful in what you've been doing, please feel free to share that in the chat box. And we will kind of collate all the resources, tips, strategies, your own best practices shared in a resources document that we'll email to everyone along with links to the recording and the slides after the event. So it's great that you provided these tools and resources. Some of the other questions, sorry.
I can just provide a quick overview of how we actually work and create our data visualization tool, because I think we missed that during our presentation. At Healthy Communities Institute, we actually have a development team who actually creates our visualization and does the coding behind the images that you see. So it's an iterative process working between a designer that we kind of work with out of house, that we contract to work on these different projects, as well as getting input from a lot of different people on the Healthy Communities Institute team. But we actually do rely on our development team and our group of computer programmers to actually make these visualizations come to life. I have found some tools. Some are free, some are not, and I've selected some of them that are kind of good to take a first stab at if you don't have a background in development.
Great. Thanks, Leslie. And also, I think kind of along that line, Aving had asked, how often is the data updated? And a good question here, who then ensures that the data is valid, which is a pretty critical concern?
I can definitely speak to that. That's the job of myself and the research team here at the Healthy Communities Institute. Our data is updated as new data becomes released, and that really varies. Some different data points, such as more weather and air quality, is actually updated daily. Unemployment data is updated monthly. And then a lot of the death statistics, birth statistics, different behavioral health risk factors, those are more updated annually or biannually when the source data releases it. We have a team here of several masters of public health who work and kind of look at the data, go back and iterate with the source to make sure that what we're providing you is valid and reliable.
Great. And also in speaking to the platform, Marcel had a question about integration with Salesforce. Does the HCI platform integrate with another platform like that? Is it embedded in a website? Is it then possible to pull live data from Salesforce?
Yeah, go ahead, Leslie.
No, I would say at this point, because the platform does not integrate with Salesforce. If that's something you're interested in, we can kind of have a follow-up conversation with you, but that's not a current functionality.
That being said, as I mentioned during Jared's question, the system in and of itself, we have a self-service tool. So if you've collected data, there's a way to actually upload it within the platform. So even though we have about 40 to 50 different types of data sources that are publicly available that's listed within the dashboard, there's ways to actually include data that's been collected. And so you work with our team to see how that can be included. But once you work with us, we have an account manager that trains you on how to do so.
Great. Thanks, Sheila. And I think we have time for a couple more questions. Tran had a question about the design of the sites and whether it had been validated, and if there's any way to find out how have visitors to the sites responded. Were they able to understand the data easily? And then how were you able to measure that?
This is Leslie, and I can say that we've worked both internally with validating our sites as well as working with some different clients to have them we work when we have new designs, vetting them within our internal team, and then also when we were originally creating the first iteration of the Healthy Communities site, we had an advisory group where we brought the information, including end users, different members of the community, to be able to really see what made sense, what didn't, validate some early designs with them, visitors, and we also are able to track. We are in communication with our clients often, so we do get a lot of feedback that way. As we've been working on our new data designs, we have shared it with some clients for feedback, and we are able to measure the number of people that come to our site and where they're interacting, but at this point we don't have a way to completely understand how easily they were able to understand the data, but given that that's the purpose of the site, we do hear about that a lot through our different clients. And I'm not sure if you have anything to add on that, Sheila?
Yeah, we started, as I mentioned earlier on in the presentation, there was a group that had various pilot programs. There was about 3 that started. Well, actually San Francisco is one of them, and they really took off. And I think from just being in existence and learning the needs, we have a roadmap and time frame of being able to create what our clients' needs and wants are, and so over time we try to change the site to meet those needs and goals. So I think it's always an ongoing process of improvement, and we're very much open to hearing how we can change the site to make it more understandable, accessible, and available to the communities that it serves.
Great. Thanks, Sheila and Leslie. And your last question. Early on, Jennifer had asked a question that was related to, I think, a best practice or an example that you showed early on, Leslie, about the size of the heads to demonstrate comparisons. And you had mentioned about the shading of the heads as being controversial. And I think there was a question why the shading would be controversial.
All right, I was a little concerned I might get pinged on that one, but I just wanted to say basically just choosing a single color to represent these entire race groups, that did spur some conversation. I think the main takeaway from this graph is, number one, be careful, and the font and the differences in font as well as the differences in size, and choosing a single color to display an entire race group.
Thanks, Leslie. That's great. And I think we're going to go ahead and move on. And before we do, just one quick thought that you can both offer in terms of describing the difference between an infographic and a data visualization before we move on, because I know that Leslie Yang is coming on board next, and she's going to share a lot of really great information, principles around design and strategies and tools. So just maybe your thoughts on that before we move on?
My thought is that a data visualization is an overarching term, and an infographic is a more static data visualization. I kind of did some research, and I was trying to really suss out the differences between them, and I don't really see them as two distinct entities. I think an infographic is kind of a static type of data visualization, but that is open to interpretation.
Absolutely. I have to agree with Leslie on that one. I also did some research there and found that was the differentiation that I came out with as well.
Excellent. And that is an excellent segue into our next presentation. Thank you so much, Leslie and Sheila. Excellent job. And we are going to now move on to our next speaker. And let's see here. Thank you, everyone, for the wonderful questions as well. It's a very engaging opportunity to be able to connect with our speakers and then also to learn from you all, because we also see this as a really rich landscape for learning from one another. So next, we're very lucky to have with us Leslie Yang from Awasu Design. Leslie is a visual and user experience designer based nearby in San Francisco. She has a decade of experience designing for the nonprofit sector. Previously, Leslie was the lead visual designer at PolicyLink, a national research and action institute based in Oakland, where she drove brand design and production of infographics, reports, and briefs. She's currently an experienced designer at Awasu Design, specializing in human-centered design, and we are very happy to have her here. And before we launch into Leslie's presentation, we again wanted to just kind of take a little dive, a temperature reading on what's your biggest challenge in using infographics. Let us know in the poll. Okay, it looks like, again, we have folks that would really like to have a sense of what is the right tool, what kind of resources can you connect us with to be able to use this meaningfully, as well as knowing how to tell my story, which is great because Leslie's going to do an excellent job of giving some tips on that. Storytelling is very powerful, as we saw elements of that in the HCI platform. So we're going to go ahead and move on. And welcome, Leslie. Are you there? Let me unmute you here. Hi, Leslie.
Hi, everyone. Can you all hear me?
Great. Yes.
Great. All right. So my name is Leslie Yang. I want to talk to you guys today about infographics. Ruth, just to answer your question about the difference between data visualizations and infographics, there are terms that are often used interchangeably, but I think a great way of trying to suss out the difference between the two is if you consider data visualization, like Sheila said, as more of an umbrella term. I see it as a visual interpretation of data. So you would see that as pie charts, line graphs, bar charts, those types of things. And an infographic is more of today's term of using data visuals to help tell a story. So it's telling the data story. All right, so that said, let me move into my presentation. So my background experience, I thought it'd be helpful right now immediately to start kind of providing you with some data about me. So I have a BA in sociology from Berkeley, so I'm sure there are plenty of Berkeley grads listening today and also on this panel, so it's great. I left Berkeley wanting to work for social change, and I thought that natural place to do so would be working in the nonprofit sector. And as we all know, for those of us who work in the nonprofit sector, we all wear multiple hats. And in those years that I was working in the nonprofit sector, I had the opportunity to transition to doing design work, namely at PolicyLink, which, as Lisa mentioned, is a national research and action institute that's working to advance economic and social equity. So I was there at PolicyLink for many years, really came out with a strong background and understanding of design work, but also using design to lift up great stories and lift up what works. And then just to be funny and just to have a good time with all of us today, I've officiated 4 weddings. So there's just some data for you about myself. So moving on. So the big question is, what is design? Sometimes I've gotten feedback of design being is make it pretty. And it's definitely, there definitely is an element of making some kind of design piece attractive, but more importantly, it's meant to engage you. So a great way of thinking about design is design uses visual elements and text to tell a story and move someone into action. Visual elements can often be shapes and color and how you position them, and Sheila and Leslie talked about that as well, and also text. Designers tend to perceive text as also shapes and blocks of text as shapes, but in this case, I've kept them separate. Another important part is to tell that story. A story is more about the narrative, what's happening, and from that point, design is meant to move someone into action. We've all been at a dinner party or at a party, and there's sometimes these incredible people that tell amazing stories, and you feel engaged, and you want to share that story with someone else, or you felt something. That is what good design is meant to do. It's meant to take visual elements and text, tell a story, and then, more importantly, get them to move them to some different mindset, to want to go to some community meeting, to want to partner with another nonprofit, to do something, to share this knowledge or information through social media. So there's always an action associated with design, and that's a big, important differentiator. So let's go back to what's an infographic. An infographic is a visual essay to use data to tell a story. And this is, I think, the best way to think about what an infographic is. We've all written essays in school. In an essay, you have an introduction, you have the body of the text, and then you have a conclusion. So in that case, design is very much organizing both text and visuals in a way to create that story. And in this case, really using data as a backbone of that story. So typical infographic design, in the ones that you've seen online, they're often told in a very vertical manner from top to bottom. So the top is usually introducing the situation, really just kind of laying a foundation for what's going on. The bulk and the body of that infographic is telling this data story, with supporting facts and really smart data visuals. And the bottom, there's going to be usually a solution or a call to action, or maybe multiple calls to action. That's really helping whoever is taking in this infographic invite them to want to support or do something to carry the story forward. So really 2 quick examples on bad infographics. Leslie and Sheila also have some really great examples too. If you look at this, we all know that 76% is not accurately depicted here. This is a huge issue. I don't think those of us listening are going to have as much of an issue with this, but I've worked with some designers actually who haven't accurately represented the data. So you must always respect the data and present it in an accurate fashion here. And that wasn't done here. Another bad infographic is this one. There is so much happening in this piece of design, I don't even know where to begin. I literally do not know where to start. I don't know what the main point is. I don't even know what conclusions I should draw from this infographic. And more importantly, what do you want me to do with this infographic now that I've read it or tried to read it? So this is where we really have to be clear about our data story and what conclusions we want to draw and share with the user. So, sorry, let me go back. Okay, so here are 5 very clear steps to producing a successful infographic. Now, oftentimes we're either working individually or we're working in a team in an organization. So the first thing we have to ask each other at the table is, do we have a compelling data story? Meaning that will it compel someone to share this infographic with others? Will I want to take this infographic or will I want to do something with it? Do I want to share it? Do I want to tell the story? Do I want to forward it on social media? What am I going to do with it? The second thing is when you're sitting down and you're looking over your data and you're starting to see that there are trends you want to share, start practicing telling that data story to each other internally, but also practice with people outside of your team. And if you can, practice with people outside of the sector that you work in. You're going to see gaps where the story could be much clearer. You're going to see that you need to add additional data or you could swap out different types of data. Practice telling that story. Being able to tell a great story is going to be important, both in infographics and also, I'm sure, in life as well. So the third thing is use Post-it notes to write down key pieces of data. As you're looking over the data, start just writing down one piece of data per Post-it and start organizing it and chunking it together. And that'll be really helpful as you produce your infographic. And sketch constantly. There's no need to jump into a piece of design software. That doesn't change or define your design. It's really the core content that's going to matter here. And then when you're finally very clear about what your story is, and you've vetted your data with its multiple sources, start the design process then. Do it last. Don't worry about the color schemes and the font sizes because those aren't important yet. Because it can be very distracting when you're starting to think about it. And the last thing, and this may be somewhat controversial, is that good design is not a democratic process. When you produce something visual, it has a very immediate effect on people. People might feel like this is a lot of content, or this is confusing, but then they're going to tell you right away, regardless of whether you've asked them or not. So it's important to provide the opportunity for many stakeholders to weigh in. And I always listen to every piece of feedback that people give me. I'm not able, unfortunately, to integrate their feedback because that would create confusion in terms of what's being produced. So my suggestion, my recommendation is to allow stakeholders to weigh in at the different stages, be very transparent about what their level of engagement is going to be and how much time they have to provide feedback and when, and then decrease that number at every stage. It's important to be really clear about that. And at the very end, have a small team, preferably 2 to 3 people, that make that final design decision. So what I'll do next is go into a case study of an infographic I worked on. So just some quick background is that when I was working at PolicyLink, we partnered with a really great organization called Rock United, which stands for Restaurant Opportunities Centers United. And they are really great about advocating on behalf of restaurant workers across the nation. So we partnered together to try to describe the demographics of the tipped worker, the problem of low wages contributing to high poverty rates, and then finally propose a solution for raising the federal minimum wage to $10.10. So it was a really fast-paced month where I spent, we met weekly, about an hour and a half a week to fine-tune and go over the data. We've sketched constantly, and we rechecked data, and that story was evolving. So I'll just quickly share my desktop. Great. And so this is my website, where I describe a little bit about the infographic. So I'm going to slowly scroll down. So this is the start of the infographic. So this, if you remember, this is the intro. This is presenting the key information for the demographics of tipped workers. There's some key points which I've highlighted, like 2 in 3 are women, 1 in 3 are parents, and of those, 1 in 6 rely on free lunches to feed their children, 1 in 7 rely on food stamps. Then there's some key point that is hopefully tweetable too, which is that tipped work is one of the fastest growing occupations and one of the lowest paid, especially for workers of color. And this area here is the main body where we really make our case using data to convey how important this issue is and how we want people to be able to carry this idea forward of raising the federal minimum wage. So the last part in orange is that conclusion, which asks you as the user, what would happen if we raised the federal minimum wage to $10.10 for all workers? And there are some really big conclusions here and a call to action at the end. So let me switch back. All right, so let's go back to the top 5 best practices really quickly. So the first thing we had to ask ourselves is, do we have a compelling data story? And actually, we didn't know what the final story would be. But after we met with Rock United, we felt confident enough to start analyzing the data and really start trying to figure out that data story. The other thing was that timing was of the essence. We wanted to release an infographic to add to the momentum at the time, which was calling for a higher fair federal minimum wage. That is really important for us. So the next thing is practice telling that data story to each other and people outside of our team. So when the program associate I was working with at PolicyLink, her name is Chris Schultz, we would sit together once a week and ask and start talking about what the data story was. And as we took turns telling that data story to each other, we would say to one another, so what? Why is whatever this fact is important to me? And what this practice did was it really made us create a stronger and more compelling narrative. It was so important that we were incredibly clear and could be receptive to challenges to that information. So next was using Post-its to write down key pieces of data. So as a designer, I would mock up a sketch of a design, but I found that we were always throwing in new pieces of data and taking out old pieces of data, that we found it was really helpful to write down a couple key points of data on these Post-its and then rearrange them as we saw fit to strengthen that narrative. So that was really important. And then last but not least, or the second to last, is working on design last. I purposely chose a typeface that looked like a felt marker, so it had this very clear sense of it being a sketch. But you could see now that after looking at the final product was that it very much mimicked and reflected the final layout. And so that was really helpful for buy-in the end. So the last thing is good design is not a democratic process, as I mentioned before. We had feedback from multiple stakeholders. Many people chimed in and gave us feedback. But at the end, the final approval came from both organizational heads. And what they saw at the end wasn't a surprise, because as I flip back, a lot of that layout is very much the same. So it wasn't a surprise, turning it from sketch to final design. So let's take a pause here. Lisa, I don't know if you want to introduce this poll, but it looks like people are responding. So the question I have for all of you is, have you ever worked with a design or design agency? So feel free to, it looks like there's a pretty even distribution of having worked with a designer or a design agency, which is great. I'll be able to provide insight on what that looks like for those who haven't, as well as to provide tips for those who have. So it looks like the majority of us have worked with a designer, so that's great. So this is my segue into what it would be like to work with a designer to produce an infographic. Okay, so I'm just going to move forward. So there's a really great question of when should one work with a designer or an agency versus staying in-house and working on those infographics yourself. And my answer often is you've got a budget and you're pretty clear about what your story should be. Because a designer may not have a background in statistics or policy analysis or just data analysis. They're not always going to be able to tell that story. And they don't know your audience and user base as well as you do. So they're going to depend on you to help tell that story. So knowing what that story is going to be really important. And also save you money. Having a budget is going to be important. And last but not least is you've got some guidance, some insight on how to work with the designer. And if you've got all three of those things, then you should give it a shot. But I do want to point out this one rather old graphic design / advertising perspective, which is that you can only pick 2 out of the 3 things in this triangle, which is good, fast, and cheap. If you want it to be cheap and fast, it's probably not going to be good. If you want it to be good and cheap, it may not be fast. And if you want it to be fast and good, it may not be cheap. So this is an important mindset to bring into working with anyone, of course, but also it applies here working with an agency or a freelance designer. So working with an agency or freelance designer, it's likely going to be good, but as we all know, there are no guarantees. It's important to ask for referrals from companies whose design work you admire. Most companies, when I've even cold called them, they've been totally open to letting us know who they've worked with. They're going to be fast. They will likely be faster than you, but like any relationship, it can take some time to get used to what another organization's work is, who their audience is, how they write, how they present information. So just know that if you're working with the designer for the first time, then it's likely that you need to factor this into your timeline, that they will need time to adapt to how you are presenting this information, how it should be designed and presented. And of course, we know that it's most likely not going to be cheap. Talk to a few designers and agencies to get a sense of what a realistic budget is. If you have design friends, have them give you some insight. If you're too low, I'm sure they will tell you. But many design firms, if they also have some free time or some data availability, they may have a nonprofit discount, which means that they will adjust their hourly billing rate to something lower. And just so you know that most designers and firms will bill at 60 to 100 plus hours, right, $100 plus an hour. Now, most of them will work on a agreed-upon flat project fee with a set number of design rounds. The important part, the reason why I bold the set number of design rounds is that they're not going to be able to work with you at an infinite number of rounds. The goal is for both parties to be super clear about what the scope of work is and how to best get the best product out of this experience together. So moving on, after you secure the designer, it's important to have the following things ready. So definitely have examples of infographics you admire. The more clear I as a designer know what you like and what's important to you, even just if you have competitors whose work you really like, share those too. That's going to be really important for helping us have a gauge of what you like and what works. Also have examples of your company's design work. Every company, every organization, every team has an aesthetic, and being able to match that aesthetic or even build on it is going to be a really great way for us to work together. 3, your deadline. Some people add buffers to their deadlines, and that's totally fine. But it's really going to be important to have that drop-dead deadline where we must get some design work out of this experience. And also something that I'm going to mention something at the end of this, which is I will come back to it in a second. So the last thing is your audience and where they are, whether they're online, offline, local, where are they most likely to be when they engage with this content? Knowing that is going to be really important for how I design this work. If they're on mobile, I should make the text larger than you would expect versus if they're on a desktop more often than not. And the last thing is something that is also a little bit controversial, which is that not every pairing between an organization or a client and a design agency or a designer is going to work out. So if you feel like it's not working out, it's best to stop immediately versus trying to drag this on. If it's not working and they're not understanding you or the work isn't what you need, then it's important to think about saving money and finding someone else who may be able to do the job in the way that you want it to. So save time for both yourself and the agency too. So that may be a little controversial, but it's just I want to come from a place of honesty here in talking with you. So that would be my last point there. So then perhaps you decided I'm going to do the work in-house. This goes back to the good, fast, and cheap triangle, which is it good? You know, it could be good enough. This does depend on who your audience is. Maybe they just need a pie chart to get them to see that this information, this breakdown of who's in the neighborhood is just enough for me to feel compelled to get more involved with my neighborhood. They may not need a formal design piece. In terms of speed, it may not be fast. And it's going to take you a while to get the design right, and you're going to have a lot of stakeholders giving you feedback. So it'll just take much longer than you expect. Not much longer, but it will take you longer than you expect. And then the last thing is that it's relatively cheap to be doing this work in-house. But as we all know, we all wear different hats. It's important to be clear about what your time is worth to the organization that you're working for. If your time is best spent leading another project or writing a development proposal, you're spending time on a project that may or may not be the best use of your time. So that's just something to consider. So here are some really clear design tips that I want to emphasize. It may not seem this way, but design is really about restraint. It's not about overdoing it. It's not about over-explaining things. It's being really clear and being very narrow with a very clear narrative, a very clear story. So the start is use 1 to 2 typefaces max. Don't add 5 or 6 typefaces. That I can't emphasize enough. 2, use 2 to 4 colors in total. And you know what? Black and white and gray are totally fine too. There's no need to feel as though black and white feels inexpensive or doesn't convey information well. You'll see that in the old infographic, the infographic that I mentioned was that I used blocks of color to break up sections, and that's a really easy way to take someone, to give some kind of visual indicator that they're moving through a different section, a different point of that infographic. 3, it's really helpful to make it printable on a Xerox copier. So 8.5 by 11, 11 by 17, all of those dimensions are going to be helpful. If, say, you want to present this at a community meeting, some people are not on mobile phones to look at this information. So if they just feel like they can have something in hand and that's the best use of that design, then make sure that fits those dimensions. I mentioned this before, which is maintaining the integrity of the data. Your visuals really must accurately represent that data. And Adobe Illustrator actually has ways of being able to cut and paste content like data and also bar charts and visuals into Illustrator as well. So that data can also be really easy to work with. So that the integrity of the data is still protected. Another thing is creating a visual hierarchy to all content. By visual hierarchy, I mean there are different subheads that should be smaller than the larger heads. You should be clear that this information is more important than that information. If you look at other examples of what I'll be mentioning later, you can see that there's some visual hierarchy working here. Second to last is give content space to breathe. Don't jam it all together. It's really not clear when you're trying to take in a lot of good information and it's something that's too close to something else or it's just too long. Give your data space to breathe. And last but not least, show, don't tell. This is really difficult. The visuals that you're creating are going to really help tell the story. If you add a lot of overly explanatory text, that doesn't help your case, and in fact, sometimes it could be a bit distracting. And then design resources. I know that you guys want resources. I think Leslie and Sheila mentioned a lot of really great ones too, so I think combining what we have together is going to be great. In terms of graphics, in terms of buying, maybe you're looking for a sailboat icon or you need some other types of visuals. The ones I like the most are Creative Market. We work for them in the Noun Project. The Noun Project has a lot of really good icons to use, and they're also very affordably priced. In terms of photos, if you want to use photos, you can buy affordable stock photos from iStock.com, Gear.com, and Blend Images. Blend Images specializes in more ethnically diverse stock photos. And then last but not least, there's Inspiration. Visually is really good for looking at different types of infographics. Some are better than others. Ask yourself how you feel about that. Dribbble.com is a way for designers to offer snapshots of their work. So what you'll see is really great visual design, but sometimes they're just showing small snapshots, and you may not see the whole data story or the whole story. So sometimes that's a little lost. But get a sense of, when you're on Dribbble, of how they use color, how they use shapes, and how they organize that information. Wired Magazine is really great. I really deeply admire their work in their magazine because they've done such a great job with data consistently over these decades. And in terms of design tools, okay, so I've broken it down to beginner, intermediate, and advanced. Now, what I mean by beginner, intermediate, and advanced isn't in terms of ease of use, because we all know that Microsoft Word and Microsoft Excel are not exactly fun to work with. But in terms of being able to easily use programs a lot of us have, Microsoft Excel and Word are actually not that bad. The intermediate options are what I've listed here. I don't use them very often because I tend to use Adobe Illustrator. But I've included 2 articles that are a helpful way of breaking down these types of tools. I will say, though, that you won't have as much control over the design itself. If you wanted to tweak some text, if you want to change the fonts, if you wanted to really customize it in a big way, they're not as flexible in that way. So those are just the pros and cons associated with these intermediate tools. They are a quick way of being able to visualize information. So if you just wanted to present some data in an internal team, that may be totally fine. Or if you just wanted something really quick, this would be a relatively fast option. Now, in terms of an advanced option, I feel like Adobe Illustrator is the most flexible tool out there for graphic and data-heavy design. And it may seem that it was very expensive many years ago, but these days, because Adobe has moved all of their software to the cloud, you can have access for $49 a month from a suite of their programs. Or you can pay $9.99 for one program. So those are my design tools. And thank you so much for listening to my presentation. I look forward to your questions, and I hope I can give great answers to them.
That's great, Leslie. And I know that I was privy to the slides beforehand, but just being able to walk through them with you, I learned so much already from just seeing some of those tips and resources and tools. So thank you so much for an excellent presentation. And to our other presenters, Leslie and Sheila, too, because I think it was such a great segue from really taking a deep dive from how to take some data that's often complex or a story or something that we really want to connect with our communities and make actionable and have meaning, and to be able to use the power of storytelling and other tools that are out there, both in our own house or to outsource and connect with designers such as yourself to do. So we have some time here, about 10 minutes, for some great question and answer period with these three wonderful folks that we don't often get a chance to speak with folks like yourself about these topics in public health. So this is amazing. And I think I'll just start out with a couple questions. Leslie, let's see, Lila had a great question about, do you have any advice for graphic design elements or styles that make infographics more accessible for viewers that may have disabilities? We do have a lot of folks working with communities that need to have tips for making these things more accessible. For instance, Lila mentions doing things like making some fonts easier for dyslexic readers. Some colors may be difficult for people with RG color blindness to distinguish. In your wealth of experience, have you come across any resources you could recommend? And if not, this is definitely something we could do some research and share after the event.
Sure. That's a really great question. And I think that I haven't had any deep experience in terms of working around accessibility standards. However, I know that that's a huge issue for many members of our communities. So I think what I can do is I can do some research and share it with the team, and then we'll be able to put that into the resources and tips coming out of it. But thank you for asking that question.
Great, thanks. And we did have a couple questions related to the tipped workers infographic, which is beautifully rendered, and questions about the nitty-gritty. Any ballpark figure in terms of cost to produce? We also had a question from Jennifer about how long did it take to create the infographic, and how much time was required of the ROC staff, for instance, as well.
Right. So overall, from end to end, it was about a month and a half of work. It seems like a lot of time, but there was a lot of back and forth around the data. So we were pulling data, discussing the data. I was trying to sketch to capture, to try to start telling that data story. So I know that we met weekly for an hour and a half a week for 6 weeks. And then there was my design time, which I tried to limit the most because the goal was to figure out what that story was. And then at the end, add on the visual design. So I would say it was probably 40 to 50 hours of work, including RFC's time, or United's time, the program associate that I was working with. And if you think about what a designer's hourly rate is, it would be probably over about $1,000, maybe to $2,000. It seems like quite a bit, right? But a lot of that time was spent being embedded in working with the data. So I think if you wanted to work with an agency, you could save yourself some time. You really just try to do a lot of that sketching in-house, and then work with a designer or a design agency to help refine that and add the visual design at the end. So perhaps you could be clever and find some cost savings here and there.
Great, thanks, Leslie. And Michael had kind of a specific, maybe this is preference, but do you prefer for infographics using Illustrator over another platform or program like InDesign? And Michael's asking that from the stance that he was going to do a report if there is a...
Sure. I've produced many reports for Policy Links, so I feel like I can adequately answer your question. So for InDesign, that's just the industry standard for producing all types of printed materials. And so what I do is I use Illustrator and InDesign hand in hand. What I'll do, and this is just a good way for me to talk about my workflow, is that when I was at Policy Link, I would receive data as Excel files. And sometimes they would have created a line chart or a line graph, or a bar chart. And what I would do is I would cut and paste that into Illustrator, adjust the fonts, put it into the color palette that Policy Link uses for all of their data work, and then save that file, go into InDesign, and then link that file into InDesign. So all the written content for the report is in InDesign as you would expect, and then the data itself is linked as a separate file. So if I make any changes, or as we all know, data does change, or if we may have overlooked something, I've changed the information in the InDesign file, in the Illustrator file, and then that information will be reflected in InDesign. I hope that's not confusing, but if you've used either one of those programs, hopefully that's an adequate way of explaining it.
Thanks, Leslie. And it looks like Priscilla has a question that's related to a question that Robbie also had around how to speak to different demographics or education levels or other sensitive issues with an infographic. And I know Priscilla wanted to ask her question verbally. Priscilla, if you'd still like to do that, you can go ahead and unmute your phone by pressing *6. Are you there, Priscilla? Well, let me just put it forth. Priscilla is asking, she works in mental health, and one of the challenges that they're experiencing is coming across, they oftentimes might have a client who's refusing to be part of an article that they plan to cover, or they might not be able to really find stock images that clearly, authentically represent their clients. And, in different communities, maybe it's difficult to find those types of sources or resources for, say, clients with mental health issues, but was wondering if you had any resources that you've seen, other than the ones that you shared, that would be helpful in terms of finding demographics like that and images that are genuine or authentic.
Sure, and I know that having done a lot of stock photo searches in my time, and also done some custom photo shoots to try to make up for that loss of or that gap of being able to adequately represent a specific community. I think it's just a matter of trying to think outside the box. I mean, there's the one option in terms of looking at stock photos is to change your search parameters. If you're looking for photos of people with disabilities, think about change your search term to perhaps what someone should look emotionally. So if for example, if the person you're trying to represent is depressed or tired or feeling confused, perhaps if you entered those particular search terms, then you'd find some other options. Another option is to work with friends or even models you could find if you did a Craigslist ad or looked around at different model agencies. You could ask them to interpret what it would look like if someone were if they were to appear to have this type of mental health issue. So unfortunately, there isn't some magical resource that has the images we want. It's always going to be a bit of a challenge, especially reflecting a community or a particular type of group.
Thanks, Leslie. And I think we'll take time for just a couple more questions. And I do have Leslie and Sheila unmuted as well, so I welcome you all to answer this question about we've touched in both presentations in this overarching power of storytelling and this sense of making meaning from stats and data and other kind of complex and often messy information. Any tips or resources to learn how to do this well, how to make that happen from you all?
This is Sheila. As I mentioned before, we'd be happy to connect with you to let you know a little bit more about some additional examples of storytelling through data that our clients have been able to make use of. So, I suggest emailing me and we can take you through other examples, and maybe that can help in bringing to life some ideas of your own.
So this is Leslie. I would also just say that a lot of it comes with practice and verbally presenting that information. I think a lot of us can be in our heads as we're writing or designing and trying to understand what the story is. But I really found that when you're telling a story to someone, then their faces have all these great visual cues. If their eyes get bigger or their eyebrows raise, they're more engaged, or they're surprised, or they're feeling something. So the point is to make a story that takes the user or takes the reader through an emotional arc. You're telling them something incredible or interesting or challenging. You're presenting them with data that's supporting the story. And then again, you give them a chance to help out in some way. That arc from information to analysis to doing something with that information, taking an action, practice that in front of as many people as you can, and then you'll find that the story that you have is really going to be something much more powerful than you thought it was when you first started.
Great. Thank you. And just in ending, any key takeaway or key strategy or one small step you think would be most helpful to share to get folks started in taking action after today?
Yeah, this is Leslie Safier, and I just wanted to say to explore, take some of these examples, go see some of the other infographics and data visualizations that people have created, and let them serve as inspiration for you and make you think about the different ways that you can potentially display your data.
Sure, I would build on that and also say that if you go on to Visually or any other sites that have a lot of infographics, take a look at them and just try to be as objective as you can and ask yourself, how does this infographic make sense to me? How come I feel inspired or compelled to make a change? And then break it down and start taking a deeper look at how the visuals, how the colors, how the data are all coming together. So I would focus on just trying to study and take it apart, because I wasn't born knowing how to produce infographics. I did the same thing. I looked at many infographics for inspiration, but also just for insight. How did they do something that was successful? And I did my best to break it down. So you guys can totally do it. I have all the faith in you. And you should all feel free to email me if you have any further questions.
Well, thanks so much to all of our presenters, Leslie and Leslie times 2, and Sheila. That was an excellent session, and as they've all iterated, they are open to being contacted for more information or guidance to, as Sheila mentioned, some great examples of folks that are implementing these so they can inspire you and motivate to do so on your own. And we will be sharing after the event today via email links to both the webinar recording, the slides, as well as we'll put together a resource document with some of the information that we have on the resources slides, as well as tips and URLs that were shared by participants in the chat box. So we just want to leave you with the thought of inspiration and motivation to take that action step with something that you learned from today to move you forward in your goals using infographics and data visualization. And feel free to let us know. We always love to check back and hear how it's going. And we are going to have a brief post survey after the event. We really appreciate your feedback. Let us know how we're doing, how we can improve, what we can do next. And on that note, I invite you all to learn about the other trainings that we have coming up around telling stories with images and video and delving into the use of Pinterest and Instagram. So I'll end it by just saying a really huge thank you and kudos to our speakers as well as everyone online today. That was a great session, and wishing you all well with your data visualization and infographics endeavors hereforth. Have a great day, everybody. Thank you.
Thanks, everyone.